Hello everyone, welcome back to my YouTube video channel. Today I will continue another series of presentation. This topic today I will share the screen, and that's where we can jump right in and have a conversation about how we arrange the treatment simultaneously, orthodontist treatment and braces at the same time. Let's see if I can share the screen. Here we go. Ready to go. I want to hit the slideshow. So how do you coordinate an implant and braces K at the same time? Sometimes your patient will be missing a couple of teeth and they do need braces. How do you go around to do this? I'm going to show you a case today. So this patient come to my office, very nice smile, uh, profile look good. But if you look on one side, on her left side, there's space there, and she's actually missing number 13. So look closely. She does have some space, and she does have some deep bite space between the anterior teeth on both sides. Black triangle right here, and the space on the lower teeth, and she have a big space on the upper left teeth. You can see this is between number 11 and number 12, and a big space on number 13 and 14. If she bite together, she doesn't show, and when she smiles, she doesn't show the lower teeth. My goal for her is to give her an implant right here, but close all the gap and give her a very confident smile with all the teeth close together. The black line triangle space will be disappear. So here's a closer look. Again, on the closer view, you can see the space between number 6 and number 5, and space between number 6 and number 7, space between 11 and number 12, and giant space between number 14 and number 12. On the bottom teeth, there is some space on the number 27 and number 26. Overall, they have like a U shape on both top and bottom. She does have deep bite, that you can see when she closed out some deep bite there. So imagine if we don't figure out a way to restore this space here and close the gap. In the future, what she that end up is having the deeper bite, and on her anterior teeth, if you look closely, you see some damaging from the wear and tear of the malocclusion and the attrition at the if she grind her teeth at nighttime when she have a deep bite. So here's a closer look again. This is before. So before we move on, I just want to remind you guys, if you love what I do, please subscribe to my channel so we can continue this journey together on an online platform where everyone can learn and everyone can share their information. The world is getting smaller and smaller, and we need your collaboration so the dentists around the world can learn, the dental assistant, the hygienist, everybody can learn together. So here is the next step. I just want to zoom in a little bit closer for her smile. As you can see, her smile with a big space there. And when we rapidly decide to close the gap, we can certainly see the change. So here is the before and after gap there. You can see the space here is getting smaller because I did some interproximal enamel reduction to close that space, triangle space. Everything is pulled back and close up, and the space here, it disappeared right there from number 11 and number 12 disappeared. So we're trying to keep the space for number 13, and we're going to eventually place the implant. Here is a series of the picture. You don't have to really go in detail. The purpose today, I just want to show you how we end up doing the implant and braces together. So these are series picture that we go from before to after and on during the treatment. Here is continue showing you this picture. So here with the end of the picture, I want to show you So when we able to close the gap between number 11 and 12 with braces and straight everything now, top and bottom, nice align, we place the implant a few months during that, before the treatment end, so we can restore the tooth before the bracket taken off. So we'll take a look, big gap, yeah, close the gap, put the implant there, restore the tooth now, and next couple of months we are ready to deband, and we can give patient retainer that can also you, you don't have to deal with the retainer that have a space here, because that create a more trouble later on. You have to adjust the retainer to fit the space there. So in this case, we restore before we take the retainer. We make the retainer for a patient. Again, if you are a general dentist and able to do braces and orthodontist combined, you able to do the patient a big favor to minimize the treatment, extended treatment from braces to implant. You can coordinate. If you are not able to do implant, you can coordinate with the implant surgeon, place the implant while the patient is wearing braces. So that the patient is done, braces is done, the implant is restored, and we can work together and achieve the shortest time for a patient, and that would give the patient more of the finishing time closer. I mean, shorter finishing time, and the patient probably going to be a lot more happy in terms of the treatment time. Anyway, guys, that's just quick video. Thanks for watching, and I hope to remind that if you like what we do, please subscribe my channel, and I will see you another future video. Thank you, guys. Have a great day. Bye bye.